Doing all right tonight. It's what time is it? 5:30 here in Tennessee. It's Dr. Morris from Magnolia Medical Center here in Middle Tennessee, and we're open and helping people with what we do best. Or what we do best is not to treat people with COVID-19. We are a health clinic. We're here to help people get well, stay well, and we're here to fix problems. We're here to fix the underlying issues for health problems. And I want to talk to you. The World Health Organization, I believe it was yesterday. My days are running together. It's been pretty crazy. Maybe it was Tuesday, but the World Health Organization came out. Some of you probably saw this in the news, but I think this is worth talking about, and it's also worth sharing because people are on social media now more than they are on the mainstream media, which in some ways that's really good because the mainstream media isn't really putting forth good information. But I'll try to keep this short. The World Health Organization says that if you or someone you love comes down with COVID 19, this new coronavirus, you should not be taking ibuprofen. There's mounting evidence that says there's an enzyme that is on ibuprofen, and I didn't get super details, but this enzyme that's in ibuprofen can significantly impact somebody recovering from and healing from the coronavirus. So if you have somebody that you know that has been diagnosed with or detected positive for the coronavirus, they really need to talk to their doctor, their healthcare provider, nurse practitioner, call a pharmacist, call somebody who understands the medications and stuff, and let them know that you're taking ibuprofen and find out what you should do about that. Ibuprofen is as an anti-inflammatory, and in some cases, we need inflammation in our body in order to promote healing. All right. So if we stop the inflammatory processes, and again, I don't know if this is the case regarding corona. I just know the World Health Organization and several other sources came out and said you really, really, really need to consider not taking. And again, please, you understand that I am giving this information over the internet, and I'm not here to diagnose, treat, cure, prevent any disease over the internet to a mass amount of people who have never seen before or treated before. So this is not medical advice. This is just some advice to talk to your doctor about, and some of the advice that's coming out from scientists and people that are actually concerned and out there and putting out what seems to be some good information. So if you know somebody who has this coronavirus or testing positive for that, even if they don't have any symptoms, they really should consider talking to their doctor, talking to a nurse practitioner, talking to a provider, or even a pharmacist about coming off of the ibuprofen or the steroids or something that might have those same enzymes in it. That might prevent the healing or prolong the disease process in the body, prolong the body's ability to fight off the infection. Currently, there's no treatment for this. Is so great about the human body. This is what's so wonderful about your human body, right? We talk about, say, what's a treatment for the coronavirus? I want you to understand what the hospitals are doing, okay? Somebody comes in and they've got the coronavirus and they've got respiratory disease and they've got the alveoli in their lungs and they've got fibrotic tissue forming in their lungs and scar tissue from this virus. What they're doing is not treating the virus. You have to get the body to treat the virus. The body's immune system has to fight off the virus. You have to do that by supporting the body's ability to break down the viral envelope, the thing that covers that viral material, that RNA or DNA material in the virus, RNA material. In the virus, you want to break down the covering so that your immune system can find and attack that stuff. So the good news is the coronavirus has a viral envelope that is actually very, very weak in comparison to some other viruses. So this virus actually has a pretty weak viral envelope. You want to support the body's immune system and its ability to fight this off. What they're doing at the hospital is they're supporting the individual while their body's fighting this off. Okay, so they're giving the body what it needs in order to mount an attack. They're also treating people with respiratory distress, so they're helping giving them oxygen. They might be giving them other medications to help other bodily functions and support them. But it is your immune system that's going to fight this virus off. So anything you can do to support that, you need to do that. And in this case, the World Health Organization is showing some research that says you don't want to be taking ibuprofen. Now, again, I cannot tell you to take or not take ibuprofen over the internet. It's not what I'm allowed to do. I'm only passing along information that is readily available out there for you to see. But if you know somebody suffering with this, you should share this video. It is the number one thing that you can do to help us out is to share the video with friends and family. Um, I'm not a big fan of ibuprofen anyway. The World Health, sorry, not the World Health Organization. Oh, now I'm forgetting. Oh, the FDA, the good old FDA, admits that 10 to 15,000 people a year, and this has been for 15, 20 years now. 10 to 15,000 people a year die from bleeding complications related to ibuprofen. 10 to 15,000 people a year. That's like a fully loaded um, Southwest jet falling out of the sky every like 3 days or something, right? So if that happened, none of you'd ever get on a plane again. But we don't think twice about popping, 2 or 4 or 6 or 8 or even 12 ibuprofen a day. People die, 10 to 15,000 people a year die from the complications related to taking ibuprofen. I'm not a big fan of it anyway, but in this situation where you need to be following CDC guidelines for washing your hands, doing all those things we should have been doing anyway, um, when we should be following guidelines about some social distancing. We should be following some guidelines, which unfortunately some of these guidelines are even out there. Like, how about you eat right, okay? Like, like Krispy Kreme donuts and Kentucky Fried Chicken and stuff. Nobody's arguing they don't taste good, all right? But they lack a nutritional value. They don't support your immune system. You need to be working at doing things to decrease stress. Go out and do things that and I know it's hard to say to do. It's hard to do that right now because everybody's stressed about not being able to go to work and this, that, and the other. But you can find things that some way, some form will reduce your stress. That maybe they're not going to take all of it away, but you can find some things that will reduce your stress. You can go out and work in your garage. That's maybe something that I would do. You could find something for sure that would help reduce your stress. Probably the number one thing you could do. And the reason that's the number one thing, in addition is like some vitamin C and vitamin D to help support your immune system, is the reason that's so important is because stress will reduce the number of white blood cells that you have circulating in your body to help fight these types of infections. So you want to reduce stress right now. So try to talk to your doctor, healthcare provider, pharmacist, whoever, if you have been diagnosed with COVID-19, and ask them about your ibuprofen intake because it's showing that it can prolong or prevent the body from repairing quickly enough. So I hope you found this helpful. The thing that I ask of you to do is hit that share button. I know some of you are sometimes reluctant to share, and I can appreciate that. But if you can hit that share button for me so that more people can get to know this information, that'd be great. And I hope you stay well. Hope you stay healthy. And nobody freaking out. I was really reading some really interesting information earlier today as well about statistical numbers related to this. And we are, while I think that we should be practicing good best practices on this, the amount of freak out over this is unbelievably blown out of proportion. It's crazy. There was some study that showed how many people in China die every month in auto accidents, right? And there's actually more people that have died in the last 4 months in auto accidents by a large volume than died with this COVID virus, and the COVID virus in that area is on its way down. And nobody was freaking out about that, So it's not to say that any of those people, whether it was a car accident or whether it was corona, should have died, or whether it's right. I just think that we have to understand that life is a little bit, you're on this planet and you're alive, and one way or another, you're not going to come out of this life alive. And we do have to understand that life is fragile. Do the right things. Have a great weekend. I may be on tomorrow if there's some new information that's coming out that you should be aware of. We want you to stay healthy and well. I appreciate you watching. This is Dr. David Morris with Magnolia Medical Center here in Murfreesboro, Tennessee. We happen to be Tennessee's largest non-drug, non-surgical pain clinic. We're trying to help people. Actually, I'll just back up for a second. Since we see people that need to be helped with pain, and we're trying to do it without drugs, and we're trying to do it without surgery, we're pretty close to the ibuprofen side of things. We hear people coming in all the time that are taking 8 and 10 and 12 ibuprofen a day, and what that does to their gut, what it does to their liver, what it does to their body's stem cell activation. It's just not good. So this, when they came out, and the World Health Organization said don't take ibuprofen. So it's like my eyes key right in onto that stuff. Like, oh my God, what is this about ibuprofen that they're saying related to this virus? So it was just this kind of key thing that I went right in on, and I was like, oh my God, here's another reason why we need to be quite a bit more careful with these things that people can just buy over the counter. My daughter was here at the office today, and she's 9 years old, and she could go buy a bottle of ibuprofen over the counter, and it's just without anybody's permission, and so there's these medications that even if they're over the counter aren't necessarily safe. So hope you found this helpful. Again, hit that share button. I appreciate you. You guys have a great the rest of your day, and we will see you next time. I'll be on again shortly. Okay, probably not tonight, but anyway, I'll be on shortly. You guys type in if there's any information you guys want or a topic you need me to cover. If I know anything about it and it could be valuable to you, I'm certainly happy to put it on here. The thing we're really good at is complex metabolic problems and chronic pain issues without drugs and surgery. So if you need any information on that, let us know. Making some other videos coming up on gabapentin. Video I did a couple years ago. I was looking at the statistics on it the other day. A video was shared 39,000 times and seen by 2.8 million people. And that was super exciting to have that information out there. It really got some people thinking about this problem. But some research that I've been doing lately shows that the arrests and people that are in prison right now because they've been dealing in gabapentin is getting a little bit. Any of one of them would be out of hand, but the numbers of them are really, really going up, and it's something we need to talk about some more on. So come back on and talk about that here maybe in the next few days. You guys have a great day. Thanks for watching. Appreciate you. Take care.